Hello, my name is Neil Patel, and this is my presentation about AIDS around the world. The country I have decided to explore was Uganda. The capital of Uganda is Kampala. The population is 44.27 million, which consists of 50% male and 50% female. The literacy rate is 73.2%. Life expectancy is 60.182, which has increased over the years. Average income is SHS, which is the currency in Uganda, 416,000. Religion is mostly Christianity, but also Roman Catholic, Protestant, and Muslim, and the government is presidential republic. The major languages spoken in Uganda are English, Luganda, and Kishwari. And Uganda is located in Africa, and it is about twice the size of Pennsylvania. Uganda has 1.3 million people living with HIV, 5.9 adult HIV prevalence, 50,000 new HIV infections, 26,000 AIDS-related deaths, 73% adults on antiretroviral treatment, and 68% children on antiviral treatment. The star indicates all adults and children are living with HIV. When was AIDS first seen? In Uganda, AIDS was first seen in the 1980s, and it was a severe epidemic. The epidemic decreased significantly in the 1990s, and this was due to government prevention and through society prevention, which we will talk about later in this presentation. Modes of transmission. The main mode of transmission of HIV is through heterosexual sex with a high risk of epidemic children through vertical transmission. What this means is that mothers that were infected with the disease HIV commonly pass it to their newborn infants. HIV type 1 is the most common strain of the virus in Uganda. HIV type 1 and HIV type 2 are the two main types of HIV. HIV 1 is the most widespread type worldwide, while HIV 2 is a less prevalent and less pathogenic type. And HIV 2 is found primarily in Western Africa. There are large genetic differences between HIV 1 and HIV 2 that test key to 1 with no reliability between the two. The groups that were most affected in Uganda were adolescent girls and young women. HIV prevalence was 4 times higher among young women aged between 15 and 24 than young men of the same age. And this was due to gender-based violence, which included sexual abuse and a lack of access to education, health services, and social protection and information on how to cope with these injustices. Sex workers were also affected commonly in Uganda, and this was due to the lack of education, like I said before. And sex workers and their clients accounted for 18% of new HIV infections in Uganda, and this was due to inconsistent condom use, and it's also due to clients often paying more for sex without a condom. Men who have sex with men were also commonly infected, and it was about 13% of the population of infected that were men that were having sex with men. And this was due to unprotected anal sex, selling sex, and having multiple studying partners, and also having multiple casual partners, and also due to blood-to-blood transmission via injecting drugs. The fishing community was also highly affected, and it was due to the community is thought to be the result of a complex range of factors, including a high degree of mobility. A high rate of fishermen would pay for sex, and they would also inject drugs often, and the lack of access to HIV prevention and testing services also affected the fishing community because they were not aware of the disease that they had or that their partners may have had. Public policy. Uganda was a nation that forcefully fully addressed the issues of AIDS. The HIV and AIDS epidemic affected a major segment of the labor force in Uganda in whose ages varied between 15 and 49, and the aim of the national policy is to provide a framework for prevention for further spread of HIV in the country. So the government would clearly tell the people what the dangers of the disease is, and they would provide evidence, and also engage people that were currently infected with the HIV, so that those that weren't infected really got the message. There was also another policy called ABC, which was known as abstinence, monogamy, and condoms, and was set up with the aim to help curb the spread of AIDS in Uganda, where HIV infections reached epidemic proportions in the 1980s, as we mentioned before. Due to these policies, HIV prevalence rates declined dramatically. Treatment for HIV. Antiretroviral treatment is used for most infected patients with HIV in Uganda, and as we know, there is no cure for HIV or AIDS, but there are many different drugs that are available to control the virus. Antiretroviral treatment uses multiple drugs in combination to fight against the virus. Some that were also infected uses prolonged drugs for treatment, and this was due to money reasons. Antiretroviral treatment wasn't available at all because they couldn't afford it, so that is why they use life prolonged drugs for treatment. Social aspect. Poor health in Uganda led to poverty. Healthcare was very expensive in Uganda and still is. There is no real system of insurance, and those that were infected with HIV were constantly in the need of medical checkups, clinic visits, and also medication. There were also major preventative efforts that were in place, such as the ABC policy. The government and society both sort of worked together to make sure everyone was aware of the dangers of HIV and how to prevent it through having safe sex, not injecting drugs or sharing needles, and the number of HIV cases have shown to decrease significantly from when HIV was first discovered in Uganda to where it is at now due to preventative cases and also through treatment options. And these are my references. Thank you and have a great night.